QAD News 8, this is WQAD This Week.
Good morning. It's Sunday, September 25th. Thank you for joining us for News 8 This Week. I'm John Diaz. It's been 2 months since the national 988 number launched, a hotline people can call or text for mental health emergencies. A crisis service center in Iowa City is in need of more workers to meet the increased demand. And as News 8's Jenna Webster explains, that demand is coming in the form of a text.
3 simple digits are serving as an important lifeline. Community crisis services in Iowa City stepping up their work since the launch of 988, answering the calls and texts for help.
It's probably the best job I've ever had.
Stephen Groom started as a crisis helpline volunteer 10 years ago. Now he helps schedule and train new volunteers.
Once I started doing this work, I didn't want to do really anything else. I wanted to be able to help people through those situations and those times.
988 replacing the National Suicide Hotline.
We list the kinds of skills that worked well with the client.
But don't let the mostly empty call center fool you. 90 volunteers are working around the clock to meet the demand of the new hotline from home.
So it's been a huge deal.
That's Director Ryan Dixon.
There has been a 200% increase in overall digital contacts. Specifically related to texting, we've seen a 780% increase in text volume.
But Groom considers that increase a good thing.
You can just call if you're in any kind of crisis.
It means more people know help is out there.
People who joke about how, oh, everything's fine when, and they clearly are upset about the situation that they're in their life. And so normalizing reaching out for help in those situations can only be a good thing.
Sometimes, he says, all you need is a listening ear. 3 digits serving as that connection. In Iowa City, Jenna Webster, WQAD News 8.
2 college students started Community Crisis Services as a grassroots organization over 50 years ago after their roommate attempted suicide and they learned there weren't enough mental health resources available. Now volunteers answer calls and messages 24 hours a day, 365 days a year. Now demand for those 988 services are up nationwide as well. New data from Health and Human Services shows there was a 45% increase in 988 calls in the month after the new number was launched. ABC's Jay O'Brien looks at the concerns at whether funding can keep up with demand.
The calls won't stop for Alicia McGuire and Anthony Carroll, part of a mobile crisis response team in Maryland, who travel in person to the most serious of suicide and crisis calls. When we met, they had just returned from one.
The call you just came back from, harrowing, trying, difficult?
Not difficult.
Serious?
Serious. Yeah.
McGuire and Carroll are busier than ever after the launch of the new 988 Suicide Lifeline number.
This is for our mobile crisis team.
Erica Turner, who runs the Maryland call center, says she's seen a 30% increase in people requesting help since the new 3-digit number launched.
We were able to hire folks, we were able to train them and get them ready for the launch.
But all of that costs money. Turner was aided by tens of millions in new federal grants that accompanied the 988 rollout. But her call center gets a large chunk of its funding from the state of Maryland.
So if you were in a state that didn't fund you like Maryland does?
We would be struggling. We would be struggling.
This map from the National Academy for State Health Policy shows less than half of states have enacted legislation to expand funding for the new 988 Lifeline. Pennsylvania is one that hasn't, and it's straining smaller call centers in that state, like the one Julie Dees operates.
So the funding that we're getting right now doesn't even cover the cost of our paid staff, let alone operations, training, that sort of thing.
Still, Miriam Delphin-Rittman, the Assistant Secretary for Mental Health and Substance Abuse, says calls, texts, and online chats are answered on average in 42 seconds. Either by an operator in or near a person's area code or by a backup location.
Are you concerned that there could come a time where the federal dollars don't flow the way they are, and there are states that aren't funding this and some of these call centers wither?
It's always difficult to predict the future, but certainly what we're having discussions and working on right now is to develop a strong infrastructure
But smaller call centers are worried if that infrastructure will hold. And Turner is anticipating even more people seeking help as more Americans learn the new number.
We want people to know just 988, just like they know 911.
Jay O'Brien, ABC News, Washington.